Medication containers. Primarily, we have ampules and vials. Ampules are glass containers. In order to retrieve the medication from an ampule, you want to follow these instructions. 1. Wash your hands. Gather your needle and syringe. Check the name and dosage of the medication to be injected. You want to turn the ampule upside down a couple of times to remove any excess fluid from the top of the ampule. Break the glass along the neckline of the bottle. It is safety glass and will not cut your skin. You want to drop the medication into the syringe. Remove the excess air from your syringe, and then follow the injection protocol. Vials. In order to retrieve the medication from a vial, you want to follow these instructions. Wash your hands. Gather your needle and syringe. Check the name and dosage of the medication. If the vial has been used before, you want to use an alcohol wipe to clean the top. If the rubber stopper is visible, it has been used previously and should be cleaned before inserting your needle into the bottle. If the rubber stopper is not visible, flip off the hard cap, and then it's ready for use. Step 5. Draw up equal amounts of air into the syringe that you intend to draw into the vial. With the bottle sitting on the table, insert the needle. Inject your air into the bottle. By putting equal amounts of air into the bottle, the pressure inside the bottle will push out the equal amount of medication. It's simple. Pull the bottle straight up. Do not bend the needle. And then you want to follow the injection protocol. Mixing dry medication. Read the bottle. Wash your hands. Clean the rubber stopper on the saline bottle, which is water. Draw up the amount of saline required by the medication. Insert the saline needle into the dry medication bottle and inject the saline. Shake the bottle to mix all the medication up, and then follow the vial protocol. Intramuscular injections. The materials you're going to need are syringe with a needle, medication, cotton ball or gauze, alcohol wipes, and Band-Aid. Technique. Draw up the medication, wash your hands, reassure the patient and explain the procedure. Select your site, which are generally the lateral upper outer quadrant of the buttocks, the lateral side of the upper outer thigh, or the deltoid muscle. Clean your site. Have the patient relax. Insert the needle quickly at a 90-degree angle, which is straight into the muscle. Sometimes people pull the muscle up in order not to hit a bone, and that's okay. Aspirate the syringe, which is to pull back on the syringe to make sure you're not into the blood vessels. If you have blood return, remove the needle and discard it to the sharps container and start the process all over again. If no blood return, go ahead and slowly inject the medication. Step 10, grab your gauze or cotton ball. Do not cover the needle with your gauze. Remember that, you'll stick yourself. Withdraw the needle swiftly, then cover the site with your gauze or your cotton balls. Have the patient hold the site for a few seconds, and then cover it with the Band-Aid. Instruct the patient on any wound care procedures. After a few minutes, check the site to make sure the patient did not have a reaction to the medication. After a few minutes, check the site to make sure the patient did not have any kind of reaction to the medication. Have the patient leave the lab. Clean up and dispose of any waste material, and then wash your hands. Page 18. Subcutaneous injections, which are called sub-Q injections. You're going to need a syringe with needle, medication, cotton ball or gauze, alcohol wipes, and a Band-Aid. Your technique. Drop the medication, wash your hands, reassure the patient and explain the procedure. Select your site, which is generally the lower inner arm, upper leg, or abdomen. Clean your site. Insert the needle quickly at a 20 to 30 degree angle. Remember to have the bevel up. Aspirate the syringe. Grab your gauze. Withdraw the needle quickly. Then cover the site with your gauze or cotton balls. Have the patient hold the site for a few seconds and then cover it with the Band-Aid. Instruct the patient on wound care. If you're doing a TB skin test, you want to have the patient return in 48 to 72 hours. Have the patient leave the lab. Clean up, dispose of any materials, and wash your hands. Intravenous injections. You will never do an intravenous injection. Never. Okay? This is very dangerous and should only be performed in a hospital setting by a registered nurse. If you're ever asked to give an injection intravenously, you have the right to decline due to the excessive liability of such an injection. Intravenous means into the vein. You would be injecting medication directly into the bloodstream, which travels immediately through the entire body and back to the heart.